Yes. So, hi everyone, and it's lovely to be here with all of you tonight. So, we're very excited here at Hope about we have an upcoming repertory course with you, Repertory XP, where we'll be sharing all things repertory. It's going to be an amazing opportunity to learn about homeopathy and specifically the repertory. So this is a really amazing opportunity because it's a hybrid course in that we will have live webinars, special webinars with masters of homeopathy and repertory. We will come live and teach special topics on the repertory. We will also then include, recorded sessions that you can watch in your own time as you need, learning about all the different repertories and repertory techniques. And along with these two, the live and the offline, you will also have the added advantage of having a mentor assigned to you. So you will have a mentor who you will meet with twice a month, and you can ask all your questions. You can bring cases that you've had in your practice, which you have difficulty applying this information that you're learning, or that you want some help with getting some clarity, or you have some doubts about how to use the repertory in certain techniques. So you will be having live sessions, you will be having offline sessions, you will be having guided mentorship. So it's really an awesome course, which will be starting in the next day. And but there's still an opportunity for you to sign up, although we're about to start in the next day or so. So please do sign up as soon as possible. But just to talk a little bit more about this topic, we thought that, it would be nice if you could meet the different mentors. So this whole week, we've had cases presented by the different mentors, and you can find these on the YouTube channel. But we would suggest that you go through them and you can familiarize yourself with, your mentors if you want to join the course. And also it's just good homeopathy that you can learn. So I will be also sharing a case tonight, as I will also be one of the mentors on this Repertory XP course. And I'd like to just share just a short case, but showing the use of repertory and the art of repertory and why it's important and why we should learn this. And just the beauty of it, because repertory is obviously a very important tool in homeopathy, and we should be familiar with it, and we should master it in some sense. So it's always great to, spotlight that. So I'd like to share a case doing just that. So the other day we had done a similar session, where I shared a case and I spoke a little bit about repertory and this course that's going to start. And on that session, you can find it on Instagram if you're looking for it. We had recorded it there. But I had spoken about a case of convulsions and epilepsy there. And I was thinking about that case, and I wanted to show you, a slightly different case, a slightly similar but different in a way. So showing you how, the repertory can be used in these cases. And so I've brought another case of epilepsy, of convulsions for you. And I thought it would be quite interesting to show it and to see the repertories that we use and the different types of repertories that we can use and why we use them, and discuss that and just spark some interest in the topic. I also really enjoy showing cases of convulsions because they're quite dramatic. They're very striking. And, these patients come and they want your help. And homeopathy is amazing in epilepsy in itself, just because they have very, very striking results as well. The disease is striking, but so are the results. And we can do really, really good things with homeopathy and convulsions. There's a lot of success. And it's also very, very useful in terms of teaching the repertory, because the rubrics that we have for convulsions and seizures, etc., are really, really interesting. And there's so much, so many different ways that we can use them and go through it. So I just thought I would like to bring another one and we could go through it with you. So this was a patient that I had seen who was a 39-year-old male. He came to the clinic. He had been suffering with convulsions since the last 4 years, and he was taking his medication for it. And he would basically have an episode about once a month. He would have one, and this had been going on for 4 years. and he wanted to do something about it. So now this the setting of this case is also interesting, and also adds to why I chose the repertory that I used in this case. Was that this was a very rural clinic where patients, they don't have much access to medical care. Often they're from a slightly less educated group. They're from a very rural area, so they don't have a huge amount of education. They don't understand necessarily what homeopathy is. They just knew that we were doctors there working at this clinic, and that we were helping people, and that we didn't charge very much. So they wanted to come to this clinic. But in these situations, they don't really understand the importance of individualizing symptoms and mental symptoms and dreams, etc. So they mostly just come and they say, I have epilepsy, and they would like an injection and to be on their way. This is the sort of mindset in this area. So this becomes important in the way that we take the case, and also how we analyze the case, because usually we have much less information. So a 40-year-old or 39-year-old male from this area and economic background, etc., they don't talk a lot. They don't want to talk about their feelings, emotions, or dreams, or anything like that. So we have to go straight to the matter. And so luckily, in a case like convulsions, the symptoms are quite clear. And using repertory as well, we can also work on our case taking. When we ask about the symptoms, we can use the repertory to guide our case taking, to understand which questions to ask about modalities, concomitants, etiologies, etc. All of these play a part in selecting the remedy. And it's very helpful to have a good knowledge of the repertory when we're taking such cases. So very simply, the symptoms of the convulsions, he listed them. I would have to ask, very directly, because this is the only way to get the symptoms. So I'd say, how often does it happen? He would say once a month. I say, what happens in the thing? He would just say, no, it's like a very violent attack, he would say, and he would just fall down. And then you have to probe more. So I always ask in convulsions, because also, especially understanding the rubrics, I always ask, what are the symptoms before the convulsion? And I go through everything. What happens right before it happens? I get as much as I can, ask as many times as I can. Then I say, what happens during the convulsion? And again, extract as much information as possible. And then, how do you feel after the convulsion? What is the progression? Do you recover right away? What happens? So like this is my approach in these cases. So I always ask, how does it start? What happens? And so he says that every time he gets it, he would have this headache, and then he would fall. So as always, you have to go into much more detail with them. So I say, tell me about the headache. And he would say that it's a very pulsating like pain, and it's throbbing, and he feels a lot of pressure on the top of the head here. So he gets this headache, and then he immediately falls down and has an attack. Then during the convulsion, what happens? He says that he bites his tongue and his whole body starts to shake, right? And there's increased saliva. And he will also bite the tongue. There will be some blood, saliva, his body shaking. But he also says that these attacks also happen while he is sleeping. So he can be sleeping, and then all of a sudden this will attack. He gets this headache, and he starts shaking in the sleep, basically. Then after the attack, he will say that the whole body feels as if it's bruised, as if someone has attacked him or beaten him up, he says. And therefore, he wants to just lie down afterwards, because he's very tired and the whole body feels painful. So this is the progression of the disease, or the attack that we can see. So there's a lot of interesting information here. And also, when we go to the repertory, we need to understand what is individualizing, because in convulsions, for example, symptoms like biting the tongue, body shaking, increased saliva, these are very, very common. So this wouldn't be the first symptom that we go to. If we take biting the tongue, there'll probably be 20 to 30 remedies in the rubric. And it's not individualizing, because it's quite common for it to happen. So we can use these symptoms at a later date, but we don't start with this. Also, as I mentioned, because there's so less information, we don't get any dreams, we don't get any emotions, nothing like this. He doesn't want to talk about any of that. He just wants to talk about the convulsions and a little bit about the headache. Therefore, you'll see that in my analysis that I've used a repertory called the reliable repertory. And now the reliable repertory is a very interesting repertory that has been created along with the Synergy software that we use. And this has taken bigger repertories, but it's removed every symptom that has been verified. So you will only find remedies in a rubric that have been verified with the source. There are very, very few mistakes in this repertory, and it's very, very exact. And so it's very good in such pathological cases where you need to help the person, where there's obviously something very severe, but you have to be very accurate. You can't rely on mental symptoms and, kingdom differentiation, miasms, and all of these things. We will talk about this a little bit later, how we can understand, these sensation and plant families or animal groups or mineral groups, etc., later in this case. But I don't have all this information to work with. Therefore, I want to use a more condensed repertory, which focuses on the veracity of the symptoms, or how clear the symptoms are and how well confirmed they are. Then, continuing with the case, just some extra symptoms that he gives us are that he has eruptions in the genitalia, which had started about 3 months earlier, which are like a white-colored pimple. And he also complains that the ejaculation has become somewhat premature, also along with the eruptions. So his ejaculations are premature, and there's also a white discharge from the penis. So we're also seeing some sort of sexual sphere that is coming. So we have convulsions on one side, and we're also seeing affecting the sexual sphere. So sphere of action is also very important in the analysis of the remedy. So we want a remedy that would act on the nervous system and also on the sexual system, which has all of the symptoms that we've seen. So, as I mentioned earlier, some of these symptoms are quite common, but some of them are quite unique and individual. We wouldn't have heard. So, for example, in this, I've seen many, many cases of convulsions and epilepsy, but I haven't seen a case where the patient had this exact, sort of head pain and then they fall. Every time that they have the attack, they have this head pain and falling. And also this attack while sleeping. I have seen it in a few cases, but it's not so common. It's not as common, for example, as biting the tongue or the saliva. It is interesting for us. So we would like a remedy which also has this, where we can find this headache. So this begins our search. So immediately I would open reliable repertory and I look. And I keep looking until I can find this symptom, this anchor symptom, because this is very individual and it's very prominent. And it happens every time that he has this, the seizures. So it's very important. So therefore, I look for it and eventually I find it. So in sleep, I find sleep convulsions during, followed by severe pain and pressure on top of the head and epilepsy. So we can see the relation of the headache during the sleep along with the convulsion. Very important here. We also see the biting of the tongue during convulsions. As I mentioned, that is somewhat common. But in a reliable repertory, we see that it's very, it will be more the main remedies for these symptoms. We will also see that there's convulsions during sleep. And we see that there are eruptions on the pimple, eruptions like pimples on the penis. And also the seminal emission or the ejaculation is too quick. So this is the core of the presentation that we're getting from the patient. So what is important in the remedy, right, should be important in the patient. And how do we find that? By taking the most important part of the patient and forming that totality with our repertorial analysis. And so when we take these symptoms, we then find that one remedy sticks out for us. And this is Bufo rana. Bufo rana is made from the toad. right? So, and we also know that it's very well indicated in both epilepsy-like symptoms and also in the sexual sphere. It has a strong component there. So we can start to correlate. And then we also start to see soft hints at this remedy in terms of how the patient talks about that after the attack, he feels as if he's been beaten by someone, as if he's been attacked. This is the feeling. So this is the idea of the sixth superclass, but it's also that someone is doing something to me, which is animal kingdom, right? So we can see the animal kingdom, we can see the superclass where there's a feeling of being beaten, being injured, something like Compositae arnica family. So when we do our analysis, it's important to use all our information. We use our repertory to narrow down, and then we use our confirmation with other information. We can use kingdom information. In this case, we can use superclass information. So we use everything. We try to have an inclusive approach. We don't say, I don't work with this, I don't work with that. Whatever information the patient gives us, we use to solve the case. And so you can see how we've come to Bufo through all of this. And when we look in Fatak's Materia Medica, we will see that Bufo, and they write here, the poison of this toad has a remarkable action on the nervous system and sexual organs, which was the two areas which we saw in this case. We saw the convulsions and we saw the sexual symptoms, the eruptions, the discharge, and also the premature ejaculation. And so there's a lot of information in Bufo, but we can see how, from a symptom point of view, we can come to the remedy from the kingdom, from the superclass, from the characteristics and keynotes. We can understand this remedy very well. And so we can give Bufo very confidently and very easily it was to come to this remedy, thanks to the repertory. If we were to just look at this case, for example, from looking at these symptoms, to suddenly think of Bufo by looking at just these symptoms that have been listed here, it's very, very difficult to come to Bufo. But the repertory is like a bridge between the patient and the remedy. It brings us much closer and makes it so much easier to find. So the repertory becomes very important because there's no way that we can know a remedy from every single aspect of it and understand every single symptom that it covers, etc., etc. We don't know this about Bufo. We may know in the back of our minds that Bufo is a good remedy for convulsions, etc., but I highly doubt that we all know the symptom about the headache during sleep with convulsions. So this is how the repertory really, really helps us. And so the remedy that was given to him was Bufo Rana 30 twice a day. And he was given about a 2 weeks supply of the remedy. And so he came back, and after 3 months, he had returned to the clinic. And he said that there were no more episodes of convulsions since starting the remedy. Normally, he would have once a month, as we said, but in this period, he hadn't had a single convulsion. He also noted that his energy was feeling a lot better, right? His sleep was also less disturbed. He had a lot of disturbed sleep before. He wasn't sleeping so well, you can imagine. And so he's sleeping very well, which obviously goes along with the energy improvement. He hasn't had any headaches. The eruptions on the genital are greatly reducing and almost gone. Also the discharge along with it. And then he continued to follow up with us. And then after a while, he stopped because there was no reason for him to return because he was doing so well. So we haven't seen him again since then. But this was just a very, very short case just to illustrate the repertory, and also noting that we use the reliable repertory. And it becomes very important which repertory we're using, because if we had to use, for example, a much bigger repertory, like a complete repertory, which has many, many remedies, we might get a bit confused and a bit lost. We don't have the mental symptoms to differentiate in this case so much. We don't have huge generalities either to work with. So we're very limited. So we want a repertory that has very specific symptoms, which are well backed up and are evidence-backed in some sense. So we use the reliable repertory in this sense. We also, if we had to use a smaller repertory, it's possible that we could find Bufo through it, but I don't know the rubrics that would find Bufo so well in a smaller repertory. It would be very difficult to find, this headache, the sleep symptom. I'm not sure that it can be done. It would be an interesting exercise to look at like a FATAC repertory or a NAIR repertory or something like that. But for this case, just taking the patient and having that feeling that in this case, I need to use the reliable repertory. This is also something that comes with practice and experience, and that we want to talk about in this course is that that experience that which repertory can be used, which rubrics exist in which repertory, so that we can use that repertory in this case. So this knowledge comes with experience, and that will come through the live webinars, the lecture videos we give you, the mentoring. It all causes a lot of exposure to all these different repertories, rubrics, remedies, etc. So it's very, very important to have that exposure, to know when to use the right repertory, etc. Just by taking this case, I could see that it needed the reliable repertory. And so I went with that and I found the remedy and it worked wonderfully. So this is the idea of this course, is to help sort of provide this information to others so that they can also gain it. And you can see how inclusive it is as well. We use all our information, symptoms, mind symptoms if they're there, physical symptoms, generalities, superclass information, kingdom information, miasm information. All of it is there. So I would highly recommend a course like the Repertory XP because of all these overarching factors and different ways that we will approach and assist you. So if you haven't signed up already, I would highly recommend that you do it. All the information we will put underneath this video in the details where you can sign up, etc. If there are any queries, do let us know. We would be very happy to help you and assist you in any way that we can. So yes, so thanks everyone for watching tonight, and I hope to meet you all soon. If you're joining for the course, we will get to interact with each other. So I'm looking forward to it. So yes, so thanks everyone, and I'll see you soon.